I'm Rachel with Bandwork Physical Therapy. Today I'm going to go over some exercises if you are having some low back pain. We give them to a lot of people. They're very effective. So I'm going to start off with some stretches. I'm going to go into one that's kind of an exercise stretch and then segue right into a really good exercise that we give everyone to really activate the core to kind of counteract some of the abs and back for the whole core. So to start, I'm going to go over the first one that a lot of people really enjoy is having feet on the mat table or bed or floor, and just letting the knees fall side to side. Now when you do this, try to give it a nice little hold for about 3 seconds to each side. If you've been to our clinic, you'll hear us say do 30 of these, which seems excessive. And at first, it might feel a little tight, might kind of hurt a smidge, but when you stretch, a big key is to have a good pull without pain. And as you do a few of them, it will really nicely loosen the back up. So doing those. And when we say 30, it would be 1 and then 2 and 3, not 30 to each side. Okay. Another one that we like to give you is a single knee to the chest. And all that means is bringing the knee, giving it a nice tug, and hold. About 20-second hold. I did not do 20 seconds just because I want to show you both sides. But you will hold for 20 seconds. Do it 3 times on each side. Again, just a nice little pull on the back. The next one is called a piriformis stretch. Now your piriformis is located in your glutes area, and it's a key culprit for some back pain when it's really tight. So you want to bring ankle over opposite knee, and then bring your knee towards your armpit. So it's a diagonal pull, not up towards your chest or straight over, but right in the middle. This one you'll hold for 20 to 30 seconds and do it 3 times. You really want to, again, have a nice pull without pain. Another key with stretching is do it nice and slow pull in and a nice and slow release. If you go too fast, the muscles tend to spasm out and it can get a little worse. So take nice caution, show some love for yourself. Good, and you'll do both sides. Okay, now this next exercise has been shown to be very effective for anyone who has been given the term a slipped disc or a little herniated disc, and we call it a prone press up. So it kind of looks like a push-up, but you're only using your arms. So to demonstrate, put this down here. I will go here. So you will lay on your stomach, hands about under armpits, and you're just going to press up right here. So notice I'm using all arms, no legs, and back down. You don't want to hold it up there for too long. And ideally, you will do 10 of these. If coming up this high is too painful, you can do a nice progression of starting here and just going up onto forearms and doing 10 of those. Once this feels good, you can go from forearms to a slightly higher position. And then once that feels good, doing 10 of 10, you can extend all the way up. So it's a nice progression. And then segueing into that is the most common exercise that we give to activate your deep abdominal muscles. So this helps create almost like a corset for your back that will help pull on the back muscles on this nice fascia that you have back here, which is connective tissue, all joined together. And when these pull, this pulls and disperses the pressure in the back, helping to take away some of that pain. So this one is called a pelvic tilt. So again, I'm going to exaggerate, and hips, if they're here, you just want to roll them back. You want to create a neutral spine. You don't want to be too flat. So here, roll back. When done properly, you will pull your belly button in towards the spine ever so slightly. And you will feel a nice, deep activation of those belly muscles. If it's too aggressive, you'll kick on everything too superficial in the stomach, and that's not what we want. We want those deep muscles. So nice and slow, nice and controlled. Once you have this exercise down, you can do a pelvic tilt. You can hold it. Don't hold your breath, just the pelvic tilt. And from here, you can lift legs. When you get better at activating your deep muscles in your belly, you can do this continuously. The moment you feel your back wanting to lift up, just relax out of it. Take a deep breath, and then get set again, and then go back into it. If you need to, you can tilt and lift, and then relax. And then tilt, lift, and then relax until you bring up the endurance in your belly muscles to do it continuously. And those are some very common exercises and stretches that we will give you for low back pain.